We often hear this incredible news about advancements in health, longer lifespans. But what if our standard ways of, well, measuring health are missing a critical piece of the puzzle, especially for today's younger generations? Could we be fundamentally misunderstanding what's really ahead?
Well, that's exactly the issue. The critical insight here is that traditional health forecasts, they can be genuinely misleading. They just don't fully capture how risks accumulated early in life really impact future health outcomes. It creates a pretty significant blind spot.
Okay, right. Let's unpack this then. Our mission in this deep dive is to explore a newer, maybe more robust way of forecasting health. Something that gives us a clearer picture, especially considering the ongoing U.S. obesity epidemic. So let's kick things off with how we've typically done this, the two-dimensional approach, right? This method basically just extrapolates past trends, things like life expectancy at birth. It assumes younger generations will just keep improving health-wise at a similar pace to those before them. It's actually, why you hear about pension plans getting strained or even going bankrupt sometimes. They relied on these older assumptions about longevity.
Exactly. And the real challenge, the fundamental flaw, is that these traditional methods completely overlook a crucial time lag. They only reflect the health of people who have, well, recently died. They don't factor in the health risks that younger people are accumulating today, right now, and how those risks will play out decades later. It really is like trying to predict the road ahead by only looking in your rearview mirror.
Right. That's a great way to put it. So this is where things get really interesting. Enter the three-dimensional approach. So this isn't just about age or the calendar year. It adds this crucial third dimension, your birth cohort.
The group you were born with.
Yeah, exactly. It acknowledges that people born around the same time share common experiences, societal shifts, environmental stuff that uniquely shape their health over their whole lives. It differentiates them from someone maybe just a decade older or younger.
And this cohort view, this focus on the generation, is particularly powerful when we look at something like the U.S. obesity epidemic. Honestly, traditional two-dimensional methods have severely underplayed this issue. They just weren't looking at the right data points to see that generational impact.
Okay, so let's apply this new lens. What does it show us about obesity?
Well, it reveals some genuinely concerning trends.
We're seeing that recent cohorts, younger Americans born since, say, 1960, they're becoming obese much earlier in life. Think about this stat. 20% of Americans born after 1965 were obese by ages 20 to 29.
20%, that young.
Yeah. Now compare that to those born earlier, between 1926 and 1935. They didn't hit that 20% obesity mark until they were 50 to 59 years old.
Wow, that's a huge difference.
It means today's younger generations are carrying that excess weight for a much, much larger part of their lives.
And this has profound implications for their future health. It's not just an abstract number. This more robust three-dimensional approach actually showed a slowing decline or even a reversal in coronary heart disease mortality among younger males, specifically ages 25 to 29 and 45 to 49 after the year 2000.
A reversal. So things aren't just steadily getting better for everyone.
Apparently not for these cohorts. In this specific area, it directly challenges that simple assumption of constant improvement. And we know elevated BMI significantly reduces median survival. If your BMI is 40 to 45, that could mean 8 to 10 years less life expectancy on average. We've actually already seen overall life expectancy decline in some disadvantaged U.S. counties, particularly between 1983 and 1999.
So what this really means is traditional forecasts have just systematically underestimated the health challenges coming down the pike. It's a bit of a wake-up call, isn't it, for how we project health outcomes?
Major wake-up call. And it's not just about dying earlier, it's about quality of life, too, morbidity. Three-dimensional forecasts anticipate substantial increases in chronic diseases. We're talking conditions like metabolic syndrome, earlier onset of type 2 diabetes, which, often leads to more severe long-term complications, things like amputations, blindness. It puts an immense burden on individuals and healthcare systems.
And as we kind of peel back the layers here with this three-dimensional view, there's something else, something even more profound, this intergenerational aspect.
Yes, the fetal programming idea.
Exactly. Obesity risks can actually be sort of programmed before birth through fetal programming and something called epigenetic inheritance.
Right. It essentially means the environment in the womb, which is influenced by a parent's health, their lifestyle, can program how the offspring's genes express themselves later on, affecting their metabolism, their future obesity risk.
So the choices people make today, their health behaviors, could be writing health chapters for the next generation, maybe even generations after that, regardless of their own healthy habits later. It's quite a thought.
It adds another layer of complexity and urgency.
So to kind of wrap up our deep dive today, the future of health, it seems, isn't just a simple straight line drawn from the past. It's this really complex interplay shaped by the cumulative health experiences of people alive now, especially younger generations. And traditional models have largely missed that dynamic.
And the vital implication here, especially for public policymakers, is pretty clear. There's an urgent need to adopt these more robust, these three-dimensional forecasting tools. And maybe more importantly, to redouble efforts in effective obesity prevention and intervention programs, like right now, to try and avert a future health crisis.
So here's something to think about. Given what we've discussed, how might understanding these cohort effects, these generational health patterns, change your perspective on current public health initiatives? Or maybe even change how you think about personal health decisions for you and your family?